This video is a gun on the table. It's like, if you really want to die, do this, because you're not going to be smart enough to pull it off.
Warning!
You're watching Dr. Todd Lee TV, where theoretically you could learn a bunch of cool shit.
Greetings, Earthlings. 'Tis I, Dr. Todd Lee, IFBB Pro, medical doctor, and biochemist. And today I want to talk to you about the Infinity Gauntlet of Steroids, the advanced cycle. Now, the reason why I call it this is it's a lesson of hubris. This is going to go over most people's heads. But the big point of that movie, of those two movies, Infinity War and Endgame, is that Thanos already was the most powerful. He didn't need to get the Infinity Gauntlet. By getting the Infinity Gauntlet, he precipitated his demise. The Infinity Gauntlet caused his death. Likewise, when a mere mortal like Tony Stark used the Gauntlet, he died. So when everyone wants this to be more complicated than it is, in my Your First Cycle video and in my Increasing Your Load cycle, I made it abundantly clear no normal person ever needs to have to use more than test and GH. That whatever your goals are, I don't want to be a bodybuilder. I just want to look like one. I just want to look good at the beach. I just want to have energy to play with my kids. Then you don't fucking use anabolic steroids for those things. Use testosterone and GH. Steroids are for professional athletes or bodybuilders. You might be a recreational bodybuilder, or what I like to say, someone who identifies as a bodybuilder. In my opinion, someone who doesn't step on stage isn't a bodybuilder. But most people, they want my opinion as long as it validates their bullshit, but they don't want my opinion as long as it's telling them something that they need to hear but don't want to hear it. So if someone masters level 1, they raise their testosterone until a point where they hit a maximum amount of estrogen they can handle. Then they raise their GH until they hit a maximum point of IGF-1 they can generate from the GH and the estrogen from the testosterone. The testosterone is a vehicle for the estrogen. The estrogen plus the GH generates IGF-1. Then, if they're still not growing, even though they've got perfect sleep, perfect training, and perfect nutrition per the appropriate videos, like Autopsy of Bulking for Nutrition, the Sleep Hygiene video for sleeping, and the Hypertrophy Guides for Dummies, and they've got perfect blood work per the Blood Work for Dummies video. If you watch all those 4 videos and everything's good, then you could advance to using Masteron, because it's the cleanest, safest anabolic steroid. And that should fill in the gap. However, there are some advanced applications of inferior steroids, when used sparingly and in low doses, could potentially be better than just more Masteron. Here we go. The big advantage of EQ is the collagen synthesis. The big advantage of the Deca is the anti-cortisol effect and the collagen synthesis. So because EQ isn't approved for human use, everyone knows that Deca is good for joints. So most people think that you should throw in 200 milligrams, just some arbitrary bullshit number of 200 milligrams of Deca. What about NPP? Deca and NPP are the same fucking drug. They just have different half-lives. And you should use the long-acting drug every day. There's never a reason to do any injection frequency other than every day, and there's no reason to ever use short-acting drugs. You use the long-acting drug every day, so it'd be Deca every day, along with everything else. For some reason, I say fucktards here, mass probe. Fuck probe. Fuck mass probe. Mastanathate is the only mast. You could use test SIP or testanathate. There's only one right way, my way. And if you don't like it, don't watch this channel. The Deca, fuck NPP, Deca. If you were to use 5 to 10 milligrams a day, you're going to get some cortisol suppression. If you get a combined total of Deca and EQ of about 30 milligrams a day, you'll get a much greater amount of collagen synthesis. That doesn't mean test doesn't do it. It doesn't mean that mass doesn't do it. We know Anavar does it. It's just Deca and EQ do it the best. The EQ is an AI and will lower your estrogen. So that means that it may not be the right drug for you. Deca seems to upregulate the sensitivity of estrogen receptor alpha. And Masteron seems to downregulate the activity of estrogen receptor alpha. So there's a very, very hard way to balance out perfectly your test, your mast, your EQ, and your Deca. It takes a lot of trial and error. You're going to lose hair. You're probably going to get gyno. But one day you might figure out what the perfect balance is. And that only applies to at that body weight with that body fat percentage at that age. So no one, and I mean no one, is going to be smart enough to juggle all four of those drugs. Not even me. But you want to know an advanced cycle, and I'm giving you a cycle that's advanced, but it's beyond the scope of the mind of the individual, that no one is going to be smart enough to do this right. But you want to know what the most advanced thing you can do is. And no pro bodybuilders do this either. It would be running the low dose test to get your estrogen where it needs to be. And then you have to run your Masteron to fill in the gaps. You're anabolic. Once you're anabolic, but you want to make sure you have anti-catabolic effects, you could use as little as 5 to 10 milligrams of Deca. And then if you want more of a collagen effect, you could increase the Deca and try to mitigate that with more Masteron. And you might get brain damage from having too much Deca. You could mitigate the brain damage by using EQ, but you wouldn't get the anti-cortisol effect. You would just get the collagen synthesis, and you'd have kidney damage. So the trick would be to use just the right amount, which is different for every motherfucker. I don't want anyone asking me, what's a starting dose? What do you recommend? There is no starting dose other than the lowest amount, which is like 10 milligrams. That's a starting dose. And then I don't recommend a fucking thing. In fact, the whole point of this fucking video, if you're not paying attention, is don't fucking do this. Don't do it. But I'm accused of being too black and white, and I don't believe in free will, and I'm censoring and I'm gatekeeping. Telling you this is basically putting a gun on the table in front of a toddler, but the toddler thinks they're a big boy, and then they're going to blow their fucking brains out. So after you fuck up, go to the comment section, click the link, and set up a consult with me, and I'll try to unfuck you. Which is, you're going to be pissed because all I'm going to do is roll you back to HRT and then ramp you back up as if you were watching your first cycle video, and then you're pretty much going to just stay that way because you tried it the advanced way and you fucked it up. And that's basically what this video is. This video is a gun on the table. It's like, if you really want to die, do this, because you're not going to be smart enough to pull it off. And people are going to think it's a challenge. Like, oh, I'm going to show him I'm smart. And it's like, no. So if you balance the EQ with the Deca to get up to a total of 30 milligrams a day, and we can keep the Deca under the dangerous threshold of 10 a day, you're like, wait a minute, that's only 70 a week. That's not dangerous. Well, that's what the science says. If you don't believe in science, that's cool. I'm just telling you the reality of it. You could get away with no brain damage with more Deca. You could get away with no kidney damage with EQ. But to play it the safest, 20 milligrams of EQ, 10 milligrams of Deca is still just under the threshold for brain damage. It's way over the threshold for anti-cortisol effects to Deca. And then it contributes to the EQ to hit the maximum collagen synthesis threshold without being enough to really damage the kidneys. Now, my theory is the way that it damages the kidneys is that it dehydrates the person, and that causes their blood pressure to go up. And high blood pressure and dehydration are the two greatest causes of kidney damage. Then the kidney damage causes EPO to be released, and then EPO is what drives up the red blood cells. So if you just did what I tell you to do in the hydration video, how to grow, I think it's 11 hydration, which no one does, but if you did that, you probably wouldn't get any damage from the EQ. The amount that the EQ turns down the estrogen is probably going to be canceled out by the amount that the Deca increases the sensitivity of the estrogen receptors. And if for any reason, if you need to modulate your estrogen, you could turn down your test or turn up your EQ. But if you turn down your test, your DHT goes down. If you turn your EQ up, your DHT goes up. So it needs to balance it. EQ is an aromatase inhibitor. The aromatase inhibitor prevents the testosterone converting to estrogen, which means more of it has to convert to DHT because it has to turn into something. When you 5-alpha reduce EQ, it turns into DHB. This is all covered in the molecular structure video. Like I said, if you're new to this channel, there's no fucking way you should be watching this video. This video is not for beginners. Under no circumstances should this be someone's first video. But I know I'm going to have to put up with a lot of shit for a long time because I'm not making complex enough videos. So this is a theoretical exercise in Icarus getting his wings burnt off by the sun. So now that you've mastered this, we've got 5 different drugs. You got GH, test, the only 2 you need, then Masteron, EQ, and Deca, that makes 5. You've added in the Deca for anti-cortisol and the Deca and the EQ for collagen synthesis. You still get anti-cortisol from test. You still get collagen synthesis with test. So this is completely retarded, but this is how people think, and I want you to be aware that yes, test does do those things, but if you're keeping your test under a threshold of DHT and estrogen that's healthy, you may not have enough test to get those jobs done. And even if you were running, well, what about test only? If you're running test only, you would still have to run an AI with it and a 5-alpha reductase inhibitor with it. So why?
Greetings, Earthlings! Like, subscribe, and share this video. Share with a friend. Share with enemies. Share with people who think they know everything. Spread it like herpes. Speaking of herpes, I am a medical doctor, and I could be your doctor. Click the link in the description box. I can order you blood work. I can read the blood work. I can treat any illnesses. Basically, it's like an HRT clinic that's a one-man army. Also, I do coaching. Dr. Karina Dodson and I have a coaching business called Apex Coaching. So if you sign up with me, you get coaching, which is nutrition, programming, competition prep, or lifestyle coaching, as well as all the medical stuff. So you have 2 doctors in one business. It's going to be contest prep, the nutritionist, the programming person, and the doctor all in one. You can't beat it. It's integrated. It works the best that way. You'll love it. Make sure to do it. Click the link in the description box.
You use drugs that only do something that's when you could use the anabolic steroid that does muscle growth and the thing you're looking for. So you got 5 drugs now. You got 4 anabolics. Nobody juggles more than 2 in the real world, but you want to handle 4. Luckily, the 3rd and the 4th one are in very low doses. It's like 20 milligrams a day of EQ, 10 milligrams a day of Deca. The 6th one, the Soul Stone, is when you add an Anavar pre-training, sublingual. Now, I just had a prototype made of a DMSO preparation. I like liquid because you can measure the exact dose. You don't have to take the amount that you're given. You can just squirt it under your tongue and it absorbs. It tastes like shit, but it absorbs. That's what matters. Anavar is the 6th one because sublingual Anavar kicks in really fast and will theoretically go into the muscle and not go to non-genomic locations. It doesn't go to the hair. It doesn't go to the skin. It doesn't go to the liver. If you do it sublingually, you bypass the first pass metabolism in the liver. It goes to the muscle, and then it doesn't go to the other areas in the body. Most people, if they do it this way, will get a little bit more aggressive and a little bit stronger. It's a good pre-workout. I like it. And that would be the 6 infinity stones of anabolic steroids. GH, test, both up until the point where you get the maximum IGF-1 conversion. You drive the test up until the estrogen is capped out before you get symptoms of DHT symptoms or estrogen symptoms. You roll it back to the level. So if at 60 milligrams is too much, you roll it back to 50. The GH, you run as much GH until you stop getting an increase in IGF-1, or you start having the side effects of like hand swelling. It's usually the first side effect you get. Then you start using Masteron to mitigate, to drive you up to the anabolic load you're looking for. Once you found an effective dose of Masteron to where you're growing muscle, now you're going to add in tiny baby doses of the next 3 drugs, 20 milligrams of Anavar pre-training, 20 milligrams of EQ, and about 10 milligrams of Deca. Now, some people might be like, well, you know what? I'm more prone to kidneys and I'm not as prone to gyno. I don't care about my brain. I care about my kidneys. You could go 10 milligrams of EQ, 20 milligrams. You could go 15 and 15. The point is that the EQ and the Deca combined add up to about 30. And you want to have both because the Deca alone, if you did 30 milligrams of Deca alone, maybe you can tolerate that, but that's probably going to be a lot of brain damage. I saw great results with, and but you like thinking like, why did you change your tone? You're so inconsistent. No, motherfuckers, I tried this out. I tried this out for months, and I didn't tell any of you people about it because I know how whiny you are. You're like, why don't you tell us the results of your experiment? It's like, because the experiment's not over, fuckface. I can't give you the results until it's over. The results are in. The experiment is over. I found that the EQ caused increase in cystatin C and increases in hematocrit, even in as little as 60 milligrams a day. And it murdered my E2. Cut it down to 30. At 30, I didn't have the cystatin C and I didn't have the hematocrit elevation, but it still murdered my E2. I took it away and I replaced it with a little bit of Deca. The Deca was there the whole time, honestly. But I went from 20 milligrams a day to 30 milligrams a day. Everything was fine. Went from 30 milligrams a day to 40 milligrams a day. Started getting a little bit of tenderness on one nipple. So that's it. As I know for sure, I can handle like 30 milligrams a day of EQ and 20 milligrams of Deca. But before you think that's you, I want you to understand something. In order for me to hit my target estrogen, I have to use 100 to 120 a day. I've never seen anybody require that much testosterone to get estrogen conversion. In order for me to see 1500 testosterone on blood work, I need to use 70 or 80 milligrams a day. Most of you guys watching this, if you do what I tell you to do and do 20 milligrams every day with an insulin needle intramuscular with the 2 units of GH, most of these people are getting 1500 milligrams of test and 1500 nanograms per deciliter, 1500 test in the blood off of as little as 20 milligrams a day. So 20 in you, 80 in me. I have to use 4 times as much to get the same results you do. Most likely because I'm carrying more muscle. So because I carry more muscle, there's less in the blood because there's more in the tissue. So my body can process it. The point is that my doses are not your doses. For me to hit the dose I need of testosterone, it's about 100 to 120. I can handle 30 milligrams of EQ, but then that brings my estrogen all the way down to sub 20. I feel great. I don't have dry joints. My joints are not dry. I feel fine. I don't understand why all these people have a problem unless it's just dehydration, which is what my big theory is that no one is doing their hydration correctly. And 100% of people who do what I tell them to do with the hydration, they are like, holy shit, it changed my life. That the biggest thing you can do to change your life is switch from intermittent to daily injections. The second biggest thing you could do to change your life is drink fucking water. And you put salt in it so that when you finish drinking it, you're thirstier than when you started. I usually put about 2 grams of salt in one of these. That's 800 milligrams. That right there accounts for 4,000 milligrams of sodium a day. That's to double the daily allowance in just my fucking water, not counting that I'm putting 1,000 milligrams on every meal. So I'm getting like 9,000 milligrams of sodium a day, whereas the daily recommended amount is 2,000. It's because those doctors are fucking dumb. But they're not treating bodybuilders. And again, if you aren't a bodybuilder, you shouldn't be watching this because you shouldn't be using anabolic steroids. Everything is based on the other things. You can't just take something I say and plug it into your shitty model of reality and have it work. So taking any of my pieces of advice and taking it out of context and plugging into whatever your coach gave you could do some serious damage. That's why I don't recommend anything. I have a very clear model of exactly what to do, step by step by step, from the minute you wake up to the minute you go to bed. And if you do anything differently, it's not my fault you fucked up. You didn't do it all. And in this case, we're using Masteron as a primary anabolic. The testosterone is being used as a substrate for estrogen. The EQ is being used as collagen synthesis, and the Deca is being used as an anti-cortisol. But there's a lot of overlap in all of those. That all of them do everything. All of them are anti-cortisol. All of them are pro-collagen. So in the end, this is just an academic exercise in futility. If you can't grow off of 1,500 test and 300 IGF-1, you're probably already at your maximum limit on human potential for your genes, because you have the appropriate upper limit by far on testosterone and IGF-1. That maybe 1% of the population or less has both of those values so high. You are at the optimal human level in both categories. If you can't grow, then, and you've got your food and sleeping and training all dialed in, then that's when you would theoretically add in gear to go to the next level. And in that case, I still don't think you need to juggle 4 additional drugs at that point. I think the next reasonable thing is use Masteron, live off Masteron, and use enough Masteron. So 20 milligrams a day a test, then 30 milligrams a day a test, then 40 milligrams a day a test, then 50 milligrams. At some point, it's too much. Roll back to the safe dose. Then you start ramping up the Masteron, assuming you've already maxed out your GH. With GH, you'd go 2 units, then wait a couple weeks, then 2 more units, wait a couple weeks, use 2 more units. Some people say a half a unit, like every 2 weeks, add a half a unit. I think that would be tedious. I would just maybe use 1 unit. But the way I measure out my GH when I reconstitute it is that 10 on the insulin syringe is 2 units. But the point is that you would titrate up slow, find the upper limit, doing blood work every month so that you know exactly what you're doing. So you eventually hit, okay, at 8 units, I get the maximum IGF-1. If I go to 10 units, I get no more IGF-1. There's no reason to run more than 8 units. Same thing with test. Is like at 60 tests a day, I have burning nipples. At 50 tests a day, I did not. Roll back to 50. That's it. And then you start adding in Masteron to keep progressing, assuming you can't grow. Once you've found that upper limit, like let's say it's 40 tests a day, it's 60 Masteron a day, you're growing like a weed, there's no reason to add any more gear, but you want to cover your ass. Then the next time you start plateauing out, rather than adding in more Masteron, you add in 10 milligrams or 20 milligrams of Deca or 20 milligrams of EQ, and then the next time you add in the other one. That's it. So in the end, it might look like 8 units of GH, 40 test, 60 Masteron, 10 Deca, 10 EQ, and 20 Anavar pre-lift sublingually. Someone else might be 50 test, 100 mast, might be 15 EQ, 15 Deca, and 20 Anavar. Me personally, I got to approximate it because it's kind of hard. Because if you didn't ever have to make adjustments, the shit would be different. So if I was just come up with an ideal cycle for myself based off of my recent data, I would say it'd be 8 units of GH, 100 test, probably 140 Masteron, 10 EQ, and 20 Deca with 20 sublingual Anavar. That's it. It's not a lot, not for a professional bodybuilder. It really isn't. So this is a super advanced Thanos level Infinity Gauntlet cycle. Is it dangerous? No. I'm using the safest compounds I can in the safest way. But it's very difficult to balance because test is a substrate for E2, but EQ is an aromatase inhibitor. So it slows the conversion of the test into the E2. And then the Masteron desensitizes the estrogen receptor alpha, whereas the Deca upregulates the estrogen receptor alpha. So there's a way of balancing all this shit out. And it takes a lot of practice and fine tuning. And most people just straight up are not smart enough or observant enough or mentally stable enough to fine tune 4 variables at the same time that contradict each other. Because it's not linear, it's exponential. If you turn down one knob and turn up the other knob, you're not going to get a 2 or 3% increase. You're going to get like a 400% increase. It's super advanced. So what you got to do is turn down one, wait a month, do blood work, and then turn up the other one. And it's just fine tuning those knobs will take forever. And most people are just not that smart. So there's the advanced would be test in GH, intermediate would be test GH Masteron, not for anyone who's not a bodybuilder. And then the super advanced shit would be, you would have to add in Deca and EQ pretty much at the same time and balance them just right. And most people don't have the patience or the attention span or the perception, nor do they want to run blood work that much. And it's useless if you're not running the blood work, because you have to literally dial in your EQ and your Deca to get the exact right amount of E2 and the symptoms. But in theory, you would have better, more durable joints. And rather than just building muscle through anabolic pathway, you're not losing muscle through the catabolic pathway. And since the threshold for those effects are so low, you never have to run more than a total of 200 a week. I'm only saying it this way because there's some people that are just too dumb to do math. That I say 30 a day of EQ and Deca, but 30 times 7 is 210. So everyone who's doing that 200 milligrams a week of Deca, if you just even cut that in half and did 140 Deca and 70 EQ, or 140 EQ and 70 Deca, you're going to get pretty much better or the same results. It all depends on how you respond to estrogen. So I've said it over and over and over again. Until next time, may the force be with you. I'd like to thank our sponsor, Fusion Regenerative Therapies, where I am the Director of Human Performance. This is the practice in which I practice medicine. We will be able to order you blood work and read your blood work and help you with therapy as needed based upon the results of your blood work. Please click the link to get a consult with me, and I can help you optimize your performance. Thank you.